The Pinnacle Awards. Proper medication use is an important issue cutting across all areas of healthcare, impacting pharmacists, physicians, and most importantly, patients. Morbidity and mortality associated with medication use continues to be a significant public health problem. Every year, an estimated $177 billion is spent on critical, preventable, drug-related problems. That's why the American Pharmacists Association Foundation's Quality Center established the Pinnacle Awards with the support of Wyeth. Pinnacle Award recipients are recognized for pioneering innovative ways to improve medication use in 3 key areas: increasing the use of national treatment guidelines, improving patient adherence and outcomes, and enhancing collaboration among all members of the healthcare team. Many performance improvement opportunities are related to systems issues that can be addressed through quality management methods. Tonight, we honor those committed to medication use quality improvement and share their experiences so that all may benefit. Celeste Flowers lives by the belief that if you treat people fairly and with respect, they'll reciprocate.
I just thought that if I'm going to be a pharmacist, for example, it's there to help other people. So giving back was as ingrained in my conduct as it was to get up on Sunday morning to go to Sunday school.
Flowers graduated from Howard University in 1958 and moved to California after serving in the military. He worked as a pharmacist and spent months planning and saving to start his own business. In 1964, he opened The Apothecary, the first of what is now a chain of pharmacies in working-class neighborhoods.
So The Apothecary was intended to say, here's a pharmacy that sells nothing but medicines. We're experts in nothing but medicine.
Within a few years, he founded Ramsell Corporation, based in Oakland, California, as a holding company for his successful community pharmacies.
We hired, we trained, we promoted, we encouraged people out of that community. They know that community that I got to know as well as I do. Everything the good Lord made, tall, short, black, white, gay, straight, not sure, represent the men and women in Ramsell. We call ourselves a family.
Flowers entered the public health arena in the 1970s, working as a pharmacy director on an independent contract with the Department of Mental Health to provide methadone treatment services in San Francisco's impoverished Western Addition neighborhood.
He got to know the people a little bit better. He met the patients and talked to them and got a flavor for their lives. And in doing so, discovered an opportunity. At the time in San Francisco County, where a patient at that methadone clinic would receive their treatment, they would see a psychiatrist, but if that psychiatrist had issued them a prescription, they would have to leave the clinic and go to the other side of town, to San Francisco General, to actually pick up the medication. Well, my father's idea, again, focusing on continuity of care, access to care, actually established the first outpatient prescription drug plan in San Francisco for their mental health department.
With his reputation as a leader in the field already established, San Francisco County turned to Flowers and Ramsell to manage its AIDS drug assistance program.
The model that my father developed in San Francisco in 1992 and 1993 is today the model that runs the largest AIDS drug assistance program in the country.
Along the way, Flowers realized the power of technology and began developing healthcare administration solutions.
What's different about us is that we use very cutting-edge technologies, and we gain great economy of scale through use of those technologies to be able to deliver better quality of life to people at a low cost.
Ramsell has grown to include 4 companies and a nonprofit organization called the Flowers Heritage Foundation. 10% of each company's profits are donated to the foundation, whose mission is to help those with HIV/AIDS receive access to life-saving medications.
The Flowers Heritage Foundation is the heart of Ramsell Holding Corporation, or the conscience for that matter. We are a vehicle or a reflection of Sill Flowers' commitment to giving back to the community.
My mom, Carrie, taught me and oriented me to take care of the people that make themselves available, that in turn take care of you. This is Carrie's dream. Giving back is what we're supposed to do. That's a corporate responsibility that I embrace with all my heart.
Sill, in my view, is unique because he's bright, he's competent, and he's socially sensitive. And he can articulate equally with people of all levels of society.
My grandmother would say that Sill has a good heart, and a good heart glows, and people can't miss that. And I see that in Sill every time I'm in his presence. It's not only his amazing sense of humor, but it's the way he has an ability to connect to almost every person he comes in contact with, no matter what age, sex, color, race, creed, you name it. He has that innate ability, and that's almost magical.
I think he really recognizes and appreciates where he's come from, the road that he's traveled, and it's like every day is kid in a candy store where you get to really reap the benefits of all that he's worked for and appreciate what he has going on around him and the people that are in his life. And so he's complex yet simple, but he's a caring man, a proud man, and I'm proud to have him as my father.
Sill has been a mentor. He's resourceful and an innovator. What I admire most about Sill is his dedication to service and his ethical values and serving the community that has served him for over 40 years.
For his many significant contributions to the safe distribution and accessibility of medications, the APhA Foundation honors Sylvester Flowers with a 2009 Pinnacle Award. Novant Health is a not-for-profit, integrated healthcare system. Based in Winston-Salem, North Carolina, Novant serves more than 5 million people in North Carolina, South Carolina, and Virginia. In 2005, Novant participated in a study to examine adverse drug events leading to hospital admissions. The study found that patients 65 and older are twice as likely to be treated in an emergency room for an adverse drug event and 7 times more likely to require hospitalization. These results led to the development of the SafeMed program. SafeMed targets patients over the age of 65 who are discharged from a Novant facility and followed by a Novant primary care physician.
It's a fantastic program because what it's meant to do is capture patients that leave the hospital on multiple medications or patients that are at risk of having medication problems and have them directly linked to a pharmacist.
SafeMed uses clinical pharmacists to provide patient education about medication safety, reconcile the medication regimen, identify potential complications of therapy, and provide the primary care physician with a complete list of each patient's medications.
When I see a patient that's been in the hospital and discharged on multiple medications, they always have been linked with the SafeMed pharmacist. So I have a sheet in my hand that shows exactly what medicines they're taking, and I feel 100% confident that the patient understands that they're taking those medicines and that they have the prescription and taking them correctly. So we're starting on a page where we're all understanding the medicines from day one.
Yeah, Mr. Smith, my name is Becky Bean. I'm a pharmacist and I work with Novant Medical Group.
Once the pharmacist reviews the discharge medication list, the patients are called to provide a targeted intervention.
By having a pharmacist call the patient as soon as they get out of the hospital, we give them a connection between the hospitalization and their primary care physician. We go over all the medications in the hospital that they were on in the hospital, try to make sure they understand, and they have a contact person for in the future.
We will contact patients once they're back in their home setting. That way they can have all of the medication vials at their fingertips, where we can literally run through each medication and know how they're taking the medication, how many tablets, what the dosage is, what time of day.
In addition, each patient is mailed a personalized medication list, educational materials, and a pill box to help them manage their medications.
They seem to care about me as a person, not take me as a unit like some people do. The attention to me was personal, and that was what really impressed me in the very beginning with SafeMed.
The entire SafeMed population was matched to a control group, and the results were impressive. 30-day readmission rates for the SafeMed group were lowered from 13.1% to 6%, and 60-day readmissions were lowered from 7.7% to 2.7%.
The program is wildly successful, as in my opinion. We've been able to decrease rehospitalizations related to adverse drug events by about 14%, which is huge. And that really translates to better use of dollars in the healthcare system. But more than that, it translates to better quality of life for patients and a better understanding of their disease.
It's definitely rewarding, especially when you have a patient tell you that you've helped them prevent some type of side effect. It's rewarding when you can make a recommendation to a physician that could save the patient $100 a month. It's rewarding when you can reassure a patient that they're taking the medication the way they're supposed to, or let them know a better way to take the medication, because that's going to give them more confidence that they're more in control of their health.
The SafeMed program is an outstanding example of how the principles of quality improvement can be applied to dramatically improve patient outcomes. The APhA Foundation is proud to honor Novant Health with a 2009 Pinnacle Award. In 2001, El Rio Community Health Center began the pharmacy-based diabetes management program as an innovative way to serve Tucson's Hispanic and Native American population who are living at or below the poverty level. Through the program, pharmacists serve as the primary health care provider for the patient's diabetes, hypertension, and hyperlipidemia management. Over 1,800 people living in southern Arizona are currently being helped by the program's 3 registered pharmacists.
El Rio's pharmacy-based diabetes program was started in 2001, and what was really driving the program being started is we were seeing a growing number of patients, particularly in the Hispanic population and American Indian, with type 2 diabetes, and they were struggling to control their disease. We have 70,000 enrolled patients here at El Rio Community Health Center, and 8,000 we know are already diagnosed with type 2 diabetes. Behind that is a great number, thousands of people that are pre-diabetic. So we're very invested as a community health center in both preventing diabetes and getting education and getting opportunities for people to not ever develop diabetes, but then also in this program really actively helping people manage their diabetes so they can avoid so many of the complications that happen.
Through the passage of federal and state legislation in 2000, qualified pharmacists can initiate, modify, and alter drug therapy as described by written protocols of physicians in a community health setting. The pharmacists provide diagnostic, educational, and therapeutic management services, including ordering lab tests and prescribing medication 24/7, using multiple languages to meet the needs of patients.
It's nice to come in and to actually get treated and not feel like you're coming in for a doctor's visit. It's more of a collaboration. It's a partnership between us and the patient to really get them under control. We never focus on the bad, we focus on the successes.
The primary goal of the program is to lower the following key indicators of diabetes and heart problems: A1C or blood sugar level, LDL or bad cholesterol, SBP, DBP or blood pressure level. In addition, the pharmacist offers extensive pharmacy services and patient education, sometimes lacking in a community health center. Educational materials and resources are culturally appropriate and at lower literacy levels to appeal to those who need help. El Rio's program, the first in the state to use physician-referred pharmacists to assist with diagnosis and treatment, has clearly revealed life-changing and sometimes life-saving results for a large percentage of diabetic patients.
I recommend it to my sister because she has diabetes and high blood pressure. And lately she's been all normal on that, so I would recommend it if somebody would ask me if they were sick.
Outcomes show statistically significant improvement in patient lab values and health behaviors. The number of patients at target blood sugar levels has increased to 41% compared to 6% for those under regular community health care, resulting in healthier patients and a reduction in the cost of care. In addition, patients have lost weight, stopped smoking, and regularly take medicines. The key to the program's success has been its patient-centered, culturally sensitive philosophy.
We've been able to track a lot of positive outcomes, improvements in A1C, which is a measure of diabetes control. Also, we've seen significant improvements in blood pressure, cholesterol. We've been published in a number of journals. So what we're trying to do is really educate legislators, insurance companies about the value of having a pharmacist as part of a treatment team.
The success of this program has led to the establishment of similar programs for a variety of diseases in numerous federally qualified health centers. The APhA Foundation applauds the El Rio Community Health Center for its efforts to help treat underserved populations and is proud to honor El Rio with a 2009 Pinnacle Award.